So the best answer for this case is choice E, inverted papilloma. Let's look at some of the features that makes choice E the best answer here. First, you see this expansile lesion that's expanding the sinus, expanding the ostium, but there is smooth remodeling of the bone and thinning of the bone rather than a aggressive destruction like you will see with aggressive neoplasm like squamous cell carcinoma, for example. Also, you see that there is complete filling of the maxillary antrum or the maxillary sinus cavity, whitening of ostium with extension into the nasal cavity. So this pattern alone on CT, the choice A and choice E are probably the best answer here. However, after contrast on MRI, you can see there's an enhancement pattern that's pretty characteristic for this lesion, the so-called cerebral form enhancement. So this alternating hyperintensity, hypointensity, and hyperintensity line. And some thought that this looked like cerebral gyri. Yes, it takes a lot of imagination to think so, but cerebral form enhancement is a buzzword for inverted papilloma on board exam. And you can also see this cerebral form pattern on T2 weighted sequence. So the best choice here is E, inverted papilloma. What about other answers that's not as good for this case? First of all, let's look at question A or the choice A, intracarinal polyp. As I mentioned earlier, based on this pattern right here, the expansion of the complete filling of the maxillary sinus, expansion of the ostium with a soft tissue extension into the nasal cavity toward the choana or toward the nasopharynx. That pattern is also great for intracarinal polyp. This is an example intracarinal polyp. Notice that on CT they can look quite similar. However, on MRI or post-contrast, the pattern is quite different. For the intracarinal polyp, it's an inflammatory polyp. So its enhancement pattern should be an inflammatory mucosal pattern. In other words, peripheral enhancement. Contrast that to inverted papilloma, where there is cerebral form enhancement centrally with a lesion within, a mass lesion within. So intracarinal polyp is not the best answer here. For choice B, squamous cell carcinoma, on board exam, they should show you something that's much more aggressive destruction rather than this smooth bone modeling or just thinning of the bone. So B is not the best choice here. For choice C, nasopharyngeal angiofibroma, recall that's a lesion that's vascular and that occur almost exclusively in young boys, so adolescent boys, teenage boys. The classic presentation that they presented with massive nose bleeding or nose bleedings that's out of control, sometime after minor trauma. The lesion occurred at the sphenopalatine foramen, subsequently expanding the pterygopalatine fossa. So the classic presentation on board exam, they should show you a lesion that's very vascular, often with local bony destruction. More importantly, shows you asymmetric expansion of the pterygopalatine fossa, and that's not the case here. For choice D, esthesioneuroblastoma or olfactory neuroblastoma, they probably show you a view on the coronal view. The classic picture for olfactory neuroblastoma is a dumbbell-shaped lesion with a lobular lesion that extends intracranially and a lobular lesion that extends down to the nasal cavity, and its waist is centered around the cribriform plate. So the dumbbell-shaped lesion is a classic appearance for esthesioneuroblastoma, and certainly that's not the case here. So choice E is going to be your best answer. Thanks again for your attention. Good luck on your study.